Hi guys, welcome to this session of Surgery 100 one-liners. So let's start this 100 one-liners. These are very important questions. So we are going to start, right? One by one. First tell me, what is the most common cause of bloody nipple discharge? Most common cause, Faraz, very good. Faraz, tell me, what is the most common cause of bloody nipple discharge? So guys, you know, it is duct papilloma. So most common cause of bloody nipple discharge, that is duct papilloma. This is duct papilloma. So this is duct papilloma. Right? Now see the next question. PUD orange is due to involvement of, yes, cap media, SP Mishra, tell me, PUD orange is due to involvement of its structure. So it is involvement of, very good, Sarath, Jishan Khan, Kalai, very good. So PUD orange, it is because of involvement of, right, subdermal lymphatics. So there is lymphatic permeation by tumor cells. That's why there is cutaneous edema and that is known as PUD orange. So it is due to involvement of subdermal lymphatics. This is due to involvement of subdermal lymphatics. Subdermal lymphatics. Clear? So there is lymphatic permeation by tumor cells. Okay. Very good. Saikat Ghosh, Sarath, Ila Purel, Monisha, Kalai, Cap Media, SP Mishra. Next, what is the most common site of metastasis in carcinoma breast, in CA breast and in CA prostate? Guys, tell me. Most common site of metastasis in CA breast and CA prostate. Faraz, Mahesh Pawar, very good. It's vertebral. Why Batson plexus? Very good. And in vertebra, which vertebra? In vertebra, which vertebra? Monisha, tell me. In vertebra, which vertebra? So in vertebra, obviously, it is lumbar vertebra. So in vertebra, it is lumbar vertebra. So guys, the most common site of metastasis in CA breast as well as CA prostate, that's lumbar vertebra. So this is what? This is lumbar vertebra. So this is lumbar. So this is lumbar vertebra. Clear? Next question, what is the most common organism responsible for breast abscess? Organism responsible for breast abscess, guys tell me. Most common organism, is very easy question. Organism from the skin goes to the breast. Breast abscess, Avinash, Jishan, Dr. Max, Kalai, everybody is correct. Correct answer is obviously Staph aureus. So this is Staph aureus. This is Staph aureus. It is Staph aureus. Next question. Tell me, what is the treatment of choice for cystosarcoma phyllodes, which is also known as phyllodes tumor? Cystosarcoma phyllodes, what is the treatment of choice? Saikat Ghosh, Dr. Mash, Sindhuja, Bholenath ki jai ho, Bholenath ki jai ho. VM Patidar, yes. Tell me guys, treatment of choice for cystosarcoma phyllodes, which is also known as phyllodes tumor. Which mastectomy? It is simple mastectomy or MRM? Simple mastectomy or modified radical mastectomy? Tell me guys, simple or modified radical? Sindhuja, correct answer, simple mastectomy. Because you know that in sarcomas there is no involvement of lymph nodes, that's why we just go for simple mastectomy. MRM is simple mastectomy plus removal of level 1 and level 2 lymph node, and you are not supposed to remove the lymph node. Clear? So treatment of choice, that is simple mastectomy. Clear guys? Next, can you tell me what is the most common solitary thyroid nodule? Most common solitary thyroid nodule. Saikat Ghosh. Most common solitary thyroid nodule. Yes, easy question. Yes, it's benign. What is the name? Name, most common solitary thyroid nodule. Tell me the name. Guys, it is colloid goiter. This is colloid goiter. So this is colloid goiter. Next question. What is the most common location of thyroglossal cyst? Thyroglossal cyst is a congenital condition. What is the most common location? SP Mishra, Saikat Ghosh, Vibha Roy, Nandu Raj Karan. Yes, it is infrahyoid or subhyoid. Very good. Anya Jishan Khan, it is infrahyoid or subhyoid. So this is infrahyoid or subhyoid. Clear? Next question guys, for retrosternal goiter we have to perform thyroidectomy. What kind of incision is given for retrosternal goiter? Easy question. Incision given for retrosternal goiter, tell me. It is cervical or thoracic? Incision given for retrosternal goiter, it is cervical or thoracic? Alia, first person. Sanjeev, first person to reply. Guvera, so it is cervical incision. Guys, incision for retrosternal goiter, this is cervical. So what kind of incision? We perform thyroidectomy but cervical incision. Why we give cervical incision? So that it's easy for you to ligate the vessels in the neck in comparison to thoracic incision. Next, can you tell me what is the name of autoantibodies in Hashimoto's thyroiditis? Autoantibodies in Hashimoto's thyroiditis. Easy question. Dr. Max, first person to reply. Alia, second. 143, third. Cap Media, everybody knows it is anti-TPO. And guys, what's the name? It is anti-thyroid peroxidase. So what's the name? It is anti-thyroid peroxidase, and you know in Graves' disease it is LATS, long-acting thyroid stimulator. In Graves' disease it is LATS, that is long-acting thyroid stimulator. Clear? Next question. You can see the next one. Orphan NEI nuclei are seen in which malignancy? Orphan NEI nuclei. Guys, tell me. Orphan NEI nuclei is seen in which malignancy? Orphan NEI nuclei. Yes, everybody is correct. First person to reply, Dr. Max Avinash 143 Kalai. It is papillary carcinoma. This is papillary carcinoma, and you know that orphan NEI nuclei, that is optically clear nuclei. So it is seen in papillary carcinoma. Next, can you tell me what is the most commonly injured nerve during thyroidectomy? Let me see who is the genius over here. Most commonly injured nerve during thyroidectomy. Yes. First person to reply correctly, it's Dr. Max. Dr. Max. Second person, Alia. Third is Sanjeev Sani. Guys, it is not recurrent laryngeal nerve. It is external branch of superior laryngeal nerve. So this is not recurrent laryngeal nerve. This is external branch. This is external branch of superior laryngeal nerve. This is external branch of superior laryngeal nerve, that is also known as external laryngeal nerve. So whenever you are ligating the superior thyroid vessels away from thyroid, this nerve is injured. Clear? Next, intraoperative thyrotoxic crisis is caused by. Easy question. Guys, tell me. Intraoperative thyrotoxic crisis is caused by. Tell me, guys. Yes, very good. First person, Dr. Max, most of the times you are correct, and most of the times you are the first person to reply. Yes, very good. Guera, Dr. Health, Kalai, you are also correct. What happens? There is inadequate preoperative preparation. Means imagine patient is having hyperthyroidism. You are taking the patient, you didn't make the patient euthyroid, and the moment you are giving surgical incision, what happens? Release of preformed T3, T4, and there is intraoperative thyrotoxic crisis. This is the famous question of INI-CET. So what is the answer? You have to remember, guys, it is inadequate preoperative preparation. So this is inadequate preoperative preparation. So this is inadequate preoperative preparation. Clear? So that's inadequate preoperative preparation. Okay. Next, what is the most common cause of primary hyperparathyroidism? Guys, tell me. Primary hyperparathyroidism, most common cause. Most common cause. Primary hyperparathyroidism. Yes. Adenoma. Faraz, very good. Adenoma. So you know it is solitary adenoma. Next, solitary adenoma is most commonly located in superior parathyroid or inferior parathyroid. It is most commonly located in superior parathyroid or inferior parathyroid. Yes, it's parathyroid adenoma. That is solitary adenoma. Inferior or superior? Guys, tell me. Obviously, inferior parathyroid. So this is solitary adenoma. In 80% cases, there is solitary adenoma, and which parathyroid? It is involving inferior parathyroid. Very good. It is involving inferior parathyroid. Inferior parathyroid. Next, most accurate modality for localization of parathyroid adenoma is again a famous question of INI-CET. Localization of parathyroid adenoma. Which scan? Dr. Max, again you are correct. Sanjeev, very good. It is SISTA-MEB scan. What's the name? This is known as SISTA-MEB. So this is SISTA-MEB scan. SISTA-MEB scan. So that is SISTA-MEB scan. Next, guys, tell me what is the best test for diagnosis of pheochromocytoma. Best test. Let me see who is genius over here. Best test for diagnosis of pheochromocytoma. I'm telling you, investigation of choice is 24 hours estimation of urinary catecholamines and VMA. That is investigation of choice. Which one is better than this? Very good. Guera, very good. First person to reply here. Guera, that is plasma metanephrines. So it is fractionated plasma metanephrines. Which one? That is fractionated. So that's fractionated plasma metanephrines. Clear, guys? It is fractionated plasma metanephrines. Fractionated plasma metanephrines. Clear? So it is fractionated plasma metanephrines. That's the best test for diagnosis of pheochromocytoma. Right? Next, what is the most common site of metastasis in older children having neuroblastoma? In neuroblastoma, most common site of metastasis in older children. Yes, let me see who is the genius over here. In neuroblastoma in older children, most common site of metastasis. Yes. No, Dr. Max, it's not liver. Yes, it's not liver. It is very good. Saikat Ghosh and Kalai. Both of you are correct. It's lungs. It's long bones. So it is long bones, guys. It is long bones. It goes to long bones. Next, what is the most common functional pancreatic neuroendocrine tumor in men 1? So how to remember? In men 1, mnemonic is PGI. PGI means pepoma followed by gastrinoma followed by insulinoma. But you know that pepoma, it is non-functional. So what is functional, most common functional pancreatic neuroendocrine tumor? You know that is gastrinoma. This is gastrinoma followed by insulinoma. So guys, it is gastrinoma followed by insulinoma. Clear? So gastrinoma followed by insulinoma. And if the question is most common pancreatic neuroendocrine tumor in men 1, so PGI, that is pepoma followed by gastrinoma followed by insulinoma. Clear? Next question. Diagnosis of amoebic liver abscess. Guys, tell me. Diagnosis of amoebic liver abscess is confirmed by how you confirm the diagnosis of amoebic liver abscess? Easy question. Yes, ELISA, Guerra, very good. It is serology, amoebic serology by ELISA. So we confirm it by serology. We confirm it by serology, and that is via ELISA. ELISA. Yeah? So it is serology by ELISA. Next question. Most preferred method for anatomically and surgically appropriate hydrated cyst. Tell me. Easy question. Most preferred. Most preferred method. Saikat, Faraz, Rahul, Life, Vishu, SRR, Dr. Health, Cap Media. Very good. First person, Dr. Health. First person, Dr. Health. Very good. Second, Jishan Khan, Ansh Chawla. It is pair, guys. It's pair. And you know that it's pair. Pair is not percutaneous. It's puncture. Pair is puncture, aspiration of content, instillation of coricidal agent and reaspiration. So that's pair. Next question. Easy question. What is the most common malignancy of liver? Guys, easiest question, tell me. Most common malignancy of liver. Easiest question, tell me. What's the correct answer? Easiest. FAS, it is not HCC. Life as JD and Bhavandeep or both of you are correct, guys, is metastasis. So most common malignancy of liver, that is metastasis. Most common primary malignancy of liver, that is HCC. Most common primary malignancy of liver in children, and you know that in children blastomas are more common. So hepatoblastoma, and no, most common benign tumor of liver, that is hemangioma. Clear? So here it is metastasis. Next, benign liver tumor with central stellate scar and spoke wheel pattern. Let me see who is the genius over here. Benign liver tumor with central stellate scar and spoke wheel pattern. First person to reply, Avinash Jangid. Avinash Jangid, very good. Kalai, Ansh Chawla, it is FNH, focal nodular hyperplasia. So guys, correct answer, that's FNH. This is focal nodular hyperplasia. So that is FNH. There is central stellate scar and spoke wheel pattern or cartwheel pattern or cartwheel appearance. Focal nodular hyperplasia. Next question. Tumor with raised neurotensin and B12 binding globulin. Another hint I'm giving you, alpha fetoprotein is normal. Tell me. Tumor with raised neurotensin and B12 binding globulin. Yes, alpha fetoprotein is normal. Very good. First person to reply correctly, Life as JD. Life as JD, it is fibrolamellar variant of HCC. So what is the correct answer here? That is fibrolamellar. This is fibrolamellar variant. So that is fibrolamellar variant of HCC. There is raised vitamin B12 binding globulin and raised neurotensin, but alpha fetoprotein is normal. Next, what is the investigation of choice for diagnosis of hepatoblastoma? Guys, tell me. Investigation of choice for diagnosis of hepatoblastoma. Easiest question. Saikat, Faraz, tell me. Guys, let me tell you, for liver and kidney tumors, it is CCT. But in children, we have to confirm the tumor by biopsy. So hepatoblastoma is the most common primary malignancy of liver in children. Here you have to confirm it by biopsy. So investigation of choice for diagnosis, biopsy. But if question is asked, radiological investigation of choice, then CCT. Next question. Liver segment which is spared in Budd-Chiari syndrome caused by hepatic vein thrombosis. Easiest question, guys. Which segment of liver is spared? Over a period of time in Budd-Chiari syndrome, liver will be atrophied, but that segment will be hypertrophied, leading to central hotspot sign. Can you tell me? Which one? Very good. First person to reply, Avinash Jangid, Ansh Chawla, Max Guerra Faz, caudate lobe. So guys, it is caudate lobe. You know why caudate lobe? Because caudate lobe venous drainage goes directly into IVC. That's why if there is hepatic vein thrombosis, it is spared. Over a period of time, liver will be atrophied, but caudate lobe will be hypertrophied. Clear? Next. Creatinine, bilirubin and INR. This is CBI. This is creatinine, bilirubin and INR. These are the components of its score. CBI is the component of its score. MELD score, first person Dr. Max MELD, model for end-stage liver disease. These are the components of MELD score. Creatinine, bilirubin, INR. Next, most common complication of insertion of Sengstaken Blakemore tube. Most common complication of insertion of Sengstaken Blakemore tube. When patient comes to you, patient is in unconscious state, stomach is full, and this is a big bulky tube. If you insert it, what will happen? Tell me. Yes, guys, tell me. The first person to reply correctly, Govera. Guvera, very good Guvera. It is aspiration. That's why whenever we are going to insert Sengstaken Blakemore tube, airway should be protected. Airway should be protected. Next, most common complication of TIPS, transjugular intrahepatic portosystemic shunt. TIPS, transjugular intrahepatic portosystemic shunt. What is the most common complication, guys? Tell me. Most common complication. Very good, Guera, again you are correct. And Avinash Jangid, again Dr. Max, Nanduraj Kanan, all of you are correct, guys, because there is a connection between portal vein and hepatic vein. So what will happen? The high ammonia of portal vein enters into systemic circulation. Why? Because in the liver there is urea synthesis. So rich ammonia enters into systemic circulation, leading to hepatic encephalopathy. So this is hepatic encephalopathy, most common complication. Guys, this is hepatic encephalopathy. Clear? Next question. What is the preferred vein for insertion of peritoneal venous shunt? So one end is in the peritoneal cavity. Can you tell me where is the other end? Peritoneal venous shunt. Peritoneal venous shunt, tell me. Preferred vein for insertion of peritoneal venous shunt. Yes, very good, Guera, correct. It is right internal jugular vein followed by superior vena cava. So this one is right. This is right IJV, internal jugular vein, followed by superior vena cava. Next, what is the most common cause of pre-sinusoidal intrahepatic portal hypertension? Pre-sinusoidal intrahepatic portal hypertension. Guys, tell me. Most common cause. Easiest question. Tell me. Yes. Pre-sinusoidal intrahepatic. Tell me. Yes, no. Let me see who's the genius over here. Most common cause of pre-sinusoidal intrahepatic portal hypertension. Yes, it is not cirrhosis. First person to reply correctly, Faz. Second is Nanduraj Kanan. It is cystosomiasis. So what? It is cystosomiasis, guys, you have to remember. Cystosomiasis. Clear? So this is cystosomiasis. Cystosomiasis. Very good. Next, cholesterol gallstones are made up of. What is the composition of cholesterol gallstone? Tell me. Cholesterol gallstone. Cholesterol gallstone are made up of. Easiest question. Guys, tell me. Yes, crystalline cholesterol monohydrate. So it is composed of crystalline. So this is composed of crystalline cholesterol monohydrate. So crystalline cholesterol monohydrate. Clear? So crystalline cholesterol monohydrate. Next, most common type of gallstone. Most common type of gallstone. Yes, obviously it is mixed. Very good. It is mixed. This is mixed. And if mixed is not given, mixed means, yes, 95% component is cholesterol. 2 to 3% component is black, 2 to 3% component is brown. If mixed is not there in the option, then mark cholesterol. Mixed is not there in the option, then you have to mark what? Cholesterol. Next question for you. What is the gold standard investigation for diagnosis of acute cholecystitis? Guys, tell me. Yes, tell me. I'm waiting for reply. Soumya Raj, Ogaidi, Saikat, Ansh Chawla. Gold standard investigation for diagnosis. First person to reply, Faz, Guera, Max, Kalai, Monica, SSR. Very good. So guys, it is what? This is HIDA scan. Full form of HIDA scan, hepatobiliary immunodiacetic acid scan. So that is HIDA scan. Next, what is the most common site of fistula in gallstone ileus? In gallstone ileus, the gallbladder enters into bowel. So ileus, what is the fistula? It's between gallbladder and, guys, waiting. Yes, Sanjeev Saini, first person to reply. Avinash Jangid, obviously it's duodenum. So it is cholecystoduodenal fistula. So that is, name is cholecystoduodenal fistula. What's the name? That is it is cholecystoduodenal fistula. So that is cholecystoduodenal fistula. Clear? So that's cholecystoduodenal fistula. That's the most common fistula in gallstone ileus. Next question, guys. Diamond ring sign and comet tail artifacts. These are seen on ultrasound in which investigation? Diamond ring sign and comet tail artifacts on ultrasound seen in which investigation? On ultrasound is seen in which condition? Yes, waiting for a reply, guys. Diamond ring sign, comet tail artifacts. First person Vibha Roy, second is Sanjeev Saini. Yes, so guys, this is adenomyomatosis. So this is adenomyomatosis. So it is adenomyomatosis, right? Next, number of regional lymph nodes involved in N1 carcinoma gallbladder. Number of regional lymph nodes involved in carcinoma gallbladder N1, guys, tell me. Yes, what number of lymph nodes are involved? No, Sunny Reddy, it's not 6. N1. It's not 6, guys. Tell me, number of regional lymph nodes involved in N1, stage N1. Very good. Soumya Raj, first person to reply correctly, 1, 2, 3. It's 1, 2, 3. And if it's 4 or more, that is N2. So lymph nodes 1, 2, 3, N1, 4 or more, it is N2. Very good. Padi, Gela, Rugved, very good, you are also correct. Next, maximum absorptive capacity per unit surface area. In which organ? In which organ there is maximum absorptive capacity per unit surface area? It's jejunum or gallbladder? Guys, tell me. Maximum absorptive capacity per unit surface area. It is jejunum or gallbladder? First person to reply correctly, Rahul Guvera. Yes, it is gallbladder. Jejunum is having maximum absorptive capacity, but maximum absorptive capacity per unit surface area, it is seen in gallbladder. And if it is only maximum absorptive capacity, then it is jejunum. Clear, guys? So maximum absorptive capacity is jejunum and maximum absorptive capacity per unit surface area, then it's gallbladder. Next, what is the most common type of choledochal cyst? 1, 2, 3, 4, 5. Tell me. Most common type of choledochal cyst. 1, 2, 3, 4, 5. Tell me. So guys, type 1, you know that if classification starts from 1, 2, 3, 4, 5, most common is type 1. If it starts from A, B, C, D, E, most common type is A. So here it's type 1. So it's 1, followed by type 4, followed by type 3. So it is 1, 4, 3. And you must be knowing the meaning of 1, 4, 3. Can anybody tell me what's the meaning of 1, 4, 3? It's type 1, followed by type 4, followed by type 3. So 1, 4, 3. Yes, we are supposed to send this message to one person only before midnight. और जिसका कोई नहीं होता, that person send this message to all. So it is 1, 4, 3. Clear? So next, maximum size of CVD stone removed by ERCP. Size of CVD stone which is removed by ERCP. Guys, tell me. Yes, very good. It is 1.5 centimeter or 15 mm. Maximum size removed 1.5 centimeter. Next, Reynolds pentad. It is charcoal striate plus. What are the other components? Reynolds pentad, charcoal striate plus. Yes, shock plus mental status changes. So it is charcoal striate plus shock plus mental status changes. Clear? So it is shock plus mental status changes. Clear, guys? Shock plus mental status changes. Next, very important question. According to Bismuth classification, Hyler stricture with intact confluence, it is which type? Bismuth classification divides stricture, various strictures into 1, 2, 3, 4, 5. Tell me, what is the most common type? Here, Hyler stricture with intact confluence, what is this type? Hyler stricture with intact confluence, very good, guys. It is C. It is 1, 2, 3, so it is type 3. And obviously, it will be E3. So, what is type 1? Common hepatic duct stem more than 2 centimeter. Type 2, it is less than 2 centimeter. Type 3, Hyler stricture with intact confluence. Type 4, Hyler stricture with destroyed confluence. And type 5, stricture involving aberrant right pectoral duct with or without stricture of common hepatic duct. So, guys, this is type 3. It is type 3. And according to Strasbourg, it becomes E3. So, it is type 3. This is type 3 or it's E3. It is E3. It's E3. So, very good. Soumya, you are correct. Sanjeev Saini, Amma, all of you are correct. Very good. Next. Prune tree appearance on cholangiography. This is very important question, guys. Prune tree appearance. It seems that there is peripheral pruning, selective destruction of terminal intrahepatic branch. Prune tree appearance on cholangiography. It is seen in which condition? Prune tree appearance on cholangiography. Seen in which condition? Very good. This is seen in primary sclerosing cholangitis. What is the problem here? There is selective destruction of terminal intrahepatic branch. Selective destruction of terminal intrahepatic branch. Next, in which condition pruritus precedes jaundice? Usually, in majority of patients, first jaundice comes and after jaundice pruritus appears. But here, pruritus precedes jaundice. Can you tell me in which condition? So, in which condition pruritus precedes jaundice? Guys, tell me. Pruritus precedes jaundice. In which condition? Yes, very good. Very good. So, it's primary biliary cirrhosis, SRR, FAG, Pardigilla, Vibharoy, all of you are correct, guys. It's primary biliary cirrhosis, PBC. This is primary biliary cirrhosis. Next question. What is the name of hilar cholangiocarcinoma? Name of hilar cholangiocarcinoma, guys, tell me. Easiest question. What is the name of hilar cholangiocarcinoma? Yes, Klatskin tumor, Ansh Chawla, very good. It is Klatskin tumor. So, this is Klatskin tumor. Klatskin tumor. Okay. Next question. You can see next question. Most common congenital anomaly of pancreas. Guys, tell me, what is the most common congenital anomaly of pancreas? Most common congenital anomaly of pancreas? Easiest question. It's pancreas divisum. Very good, it's pancreas divisum. So, that is pancreas divisum. That's the most common congenital anomaly of pancreas. Next, what is the treatment of choice of annular pancreas? In annular pancreas, there is ring of pancreas, ring of ventral pancreas around the second part of duodenum proximal to ampulla. So, in this case, there is obstruction. So, what is the treatment of choice, guys? Tell me. Treatment of choice for annular pancreas. First person to reply correctly, Jitendra Bajia. Jitendra Bajia, Sanjeev Saini. It is DD. And what is DD? Duodenostomy. So, it is DD, that is duodenostomy, which is preferred over duodenojejunectomy. So, DD followed by DJ. Next, what is the most common cause of death in acute pancreatitis within 2 weeks of hospitalization? When patient is hospitalized, patient shifted to ICU, within 2 weeks patient expired. Can you tell me what is the no? Padigela, it is not sepsis. First person to reply correctly, Sarthak Suthar. Sarthak Suthar, you are correct. It is MODS. What is MODS? That is multi-organ dysfunction syndrome. So, that is multi-organ dysfunction syndrome. Next, investigation of choice for diagnosis of acute pancreatitis. Guys, tell me. What is the investigation of choice for diagnosis of acute pancreatitis? Easiest question. Investigation of choice. Yes, Manish Chaudhary, very good, it is CCT. So, investigation of choice for diagnosis, it is CCT. Though, we can make the diagnosis on the basis of clinical findings plus laboratory investigation. But the investigation of choice for diagnosis, that is CCT. Clear? It is CCT. Next, in Bishop score, blood urea nitrogen level should be. What is the blood urea nitrogen level? Tell me, Bishop score. So, Bishop full form, blood urea nitrogen, impaired mental status, SIRS, age pleural effusion, age more than 60. So, how much should be the blood urea nitrogen? Blood urea nitrogen level, guys, tell me. Waiting for reply. Nobody replied correctly till yet. First person, Vibharoy. Vibharoy, very good. Blood urea nitrogen more than 25 milligram per deciliter. It's more than 25 milligram per deciliter. I'm repeating. Bishop, blood urea nitrogen more than 25. I, impaired mental status. S, SIRS. A, age more than 60. P, pleural effusion. Next, what are the components of SIRS? Yes. Mnemonic, how to remember? THR component, THR counts. So, that is temperature, heart rate, respiratory rate, WBC count. Can you tell me how much is the heart rate? Temperature either more than 36, 38 or less than 36. Heart rate, guys, tell me. Heart rate, first person to reply correctly. Kanhu Charan Das, very good. So, heart rate should be more than 90 per minute, respiratory rate more than 20 per minute, and WBC count either more than 12,000 or less than 4,000 or more than 10% immature cells on peripheral smear. So, SIRS, THR counts, temperature, heart rate, respiratory rate, WBC count. Clear? Next, in QSOFA, respiratory rate should be. What is the full form of QSOFA? Quick Sequential Organ Failure Assessment. And here, There is respiratory rate, systolic blood pressure, altered mental status. Respiratory rate should be more than. First person to reply correctly, Vibha Roy again. No. Sakshi Kumari, respiratory rate more than equal to 22 per minute. Systolic blood pressure more than systolic blood pressure is less than equal to 100 mmHg, and there should be altered mental status. Q so far. Next question, guys. Gold standard investigation for chronic pancreatitis. Easiest question. What is the gold standard investigation for chronic pancreatitis? Tell me. Gold standard, Imon Chaudhary, first person to reply correctly, it is ERCP. Investigation of choice is MRCP, but ERCP is diagnostic and therapeutic, that's why it's gold standard. Clear? So this is gold standard. Next, central sunburst calcification on CCT is seen. Central sunburst calcification. Tell me, guys, waiting. Central sunburst calcification, yes, it is seen in which condition? Central sunburst. Yes, it's a tumor of pancreas. Now tell me. Very good, Vibha Roy. This is central serous cystic neoplasm. So it is serous cystic adenoma, also known as serous cystic neoplasm. So this is serous cystic neoplasm. Clear? Or serous cystic adenoma. Next question. Amylase and CEA both are raised in a cystic neoplasm. Amylase is raised means this patient is having acute pancreatitis, and CEA is raised, it means this patient is having increased risk of malignancy. Tell me, lesion is pre-malignant, which one? It's not mucinous, guys. It's not mucinous. Tell me the third one. Yes, Sunny Reddy, you are correct. Dr. Max, you are correct. It is IPMN, intraductal papillary mucinous neoplasm. So that is IPMN, intraductal papillary mucinous neoplasm. Next, what is the most common gene mutation in carcinoma pancreas? Most common gene mutation in carcinoma pancreas. Guys, tell me. Yes, it is KRAS. Very good. Vinay Kumar, it is KRAS followed by P16. So CRAP16. It is KRAS followed by P16. Next question. There is waxing and waning of jaundice with melena. It is seen in which type of carcinoma? Which malignancy is having waxing and waning of jaundice with melena? Yes, very good. Periampullary, Dr. Max. Which type of periampullary? Periampullary, which type? Exactly. Ampullary. Sidhu Swami, correct. It is ampullary carcinoma. So this is ampullary carcinoma, guys. Ampullary. So that is ampullary carcinoma, waxing and waning of jaundice with melena. Next, you can see here, most common complication of pancreaticoduodenectomy or Whipple's procedure. Most common complication of pancreaticoduodenectomy or Whipple's procedure. Guys, easy question. Tell me. Yes. Dr. Max, leaks, no. Very good. Jitendra Bajia, you are correct. It is delayed gastric emptying. DGE, that is delayed. This is delayed gastric emptying. Clear? So this is delayed gastric emptying. Delayed gastric emptying. Delayed gastric emptying. Delayed gastric emptying. Next, gold standard investigation for diagnosis of insulinoma. Gold standard investigation for diagnosis of insulinoma. Guys, diagnosis of insulinoma, gold standard. 72 hours fasting. Very good. Avinash Jangid, you are correct. This is 72 hours fasting. So this is 72 hours fasting. Okay. Next, what is the most common site of gastrinoma? Most common site of gastrinoma. Guys, tell me. Gastrinoma. Very good. Sidhu Swami, correct. It is duodenum followed by pancreas. So gastrinoma, it is duodenum followed by pancreas. Next question, tell me, in duodenum, which part of duodenum? Gastrinoma, most common site, guys. Which part of duodenum? Tell me. Easy question. Which part of duodenum? Easy question. Yes, obviously it is first part D1 followed by D2 followed by D3, and it is not seen in D4. So it is not seen in fourth part. Clear? Next question. What is the most common symptom of glucagonoma? Glucagonoma is also known as 4D syndrome. Yes, here 4D, D, diabetes mellitus, dermatitis, DVT, depression. Tell me, what is the most common symptom? Most common symptom of glucagonoma. Guys, glucagonoma. Very good. Dermatitis. What's the name? It's a typical symptom known as NEM. Can you tell me the full form? It is NEM. So guys, you know it is necrolytic erythema migrans. So this is necrolytic erythema migrans. Clear? That's the most common symptom. Next, location of defect in Bok-Dalek hernia. Where is the defect in Bok-Dalek hernia? Bok-Dalek hernia. Guys, tell me. Defect in Bok-Dalek hernia. Easiest question. Defect in Bogdalic hernia. Very good. Very good. Left, first person, Dr. Max, it is left posterolateral. It is left posterolateral. Where is the defect in Morgagni hernia? This is left posterolateral. In Morgagni hernia, there is right anteromedial defect. Next, investigation of choice for diagnosis of GERD. GERD, investigation of choice. Investigation of choice for diagnosis of GERD. Okay, so you can see that esophagitis. Yes, investigation of choice is endoscopy, and gold standard to document the reflux, that is 24 hours ambulatory pH monitoring. So, investigation of choice, endoscopy, and the gold standard is 24 hours ambulatory pH monitoring. So, here guys, it is investigation of choice, that is endoscopy. That is endoscopy. Next, bird beak appearance, pencil tip appearance, rat tail appearance. Bird beak, pencil tip, rat tail on barium swallow, it is seen in. Bird beak, pencil tip, rat tail. Very good. Everybody is correct here. Everybody is Shiv Gajera, Halogen, Ansh Chawla, Sunny Reddy, Jaswini, Jitender, Kanhu Charandas, Sangeeta Bishwas, Mustafiza Nosreen, Holy Treasure. Everybody is correct, guys. It is achalasia cardia. So this is achalasia. Achalasia cardia. Next, corkscrew or rosary bead appearance. Again, this is very, very important. Corkscrew or rosary bead appearance on barium swallow. It is seen in which condition? Very good, Vinay. Saikat Ghosh, it is diffuse esophageal spasm. So it is seen in diffuse esophageal spasm. Very good, diffuse esophageal spasm. Next, can you tell me what is the most common symptom of Zenker's diverticulum? Zenker's diverticulum, most common symptom. Guys, most common symptom of Zenker's diverticulum. Yes, very good. Everybody is correct. It is dysphagia. This is dysphagia. Why? Because the diverticulum is compressing the esophagus. Next, investigation of choice for staging of carcinoma esophagus and carcinoma stomach. It is same in both. Carcinoma esophagus, carcinoma stomach, it is same in both. Guys, tell me. Tell me. Adigela, it is not MRI. Yes. Nikita Nayak, very good, you are correct. It is endoscopic ultrasound. So guys, for staging, it is endoscopic ultrasound. Why? Because one of the most important predictor of stage is depth of penetration. In the whole GIT, staging is mainly dependent on depth of penetration, and you can easily assess the depth of penetration with the help of endoscopic ultrasound. Next, best conduit after esophagectomy. In patient of carcinoma esophagus, you resect the esophagus and then you use alternative channel. What is that best conduit? Very good, Dr. Max, you are correct. It is stomach. So best conduit, that is stomach, and it is based on, this is stomach. It is based on right gastric artery plus right gastroepiploic artery. So right gastric plus right gastroepiploic artery. That is stomach. Here, next, Mackler's triad is positive in which condition? Guys, tell me, easiest question. Mackler's triad is positive in. Easiest question, Mackler's triad. It's positive in Sindhuja Vasu, very good. Arvind Sub, very good. Vinash Jangir, yes, it is Boerhaave syndrome. So this is Boerhaave syndrome. So this is Boerhaave syndrome. Can you tell me what are the components of Mackler's triad? There is thoracic pain, vomiting, cervical subcutaneous emphysema. Thoracic pain, vomiting, cervical subcutaneous emphysema. So that is Mackler's triad. Clear? Next, guys, treatment of choice for chronic or intractable duodenal ulcer. Easiest question. What is the treatment of choice for chronic or intractable duodenal ulcer? Yes, very good. Sunny, Saikat Ghosh, Dr. Max. Investigation of choice for diagnosis of, treatment of choice for chronic or intractable duodenal ulcer. It's not truncal vagotomy, it is vagotomy, but it's not truncal. That is for recurrent duodenal ulcer. This is intractable or chronic duodenal ulcer. Here, guys, it is highly selective vagotomy. So that is highly selective vagotomy. Next, what is the most common metabolic complication after gastrectomy? This question is very, very hot. Nowadays, this question is being asked almost everywhere. Most common metabolic complication after gastrectomy, it's not B12. When more than 50% of stomach is removed, then only there is B12 deficiency, megaloblastic anemia. Even partial gastrectomy is done. In that case also, what happens? The patient will be having this anemia. Which one? Iron deficiency anemia. So you have to remember, it is iron deficiency anemia. And when more than 50% of stomach is removed, then megaloblastic anemia, patient is having burning sensation, patient is having tingling. So signs and symptoms of hyperesthesia or paresthesia because of vitamin B12 deficiency. but the most common is iron deficiency anemia. Next, according to Forest classification, non-bleeding visible vessel, which type? Let me see who is the first person to reply here. Non-bleeding visible vessel. Yes, very good. Non-bleeding visible vessel. So guys, you know that type 1A, active pulsatile bleeding, 1B, oozing, 2A, non-bleeding visible vessel, 2B, adherent clot, 2C, black dot, 3 clean base. So 2A, non-bleeding visible vessel. So this is 2A, non-bleeding visible vessel. Next, what is the most common artery responsible for bleeding in Mallory-V syndrome? Most common artery. Most common artery responsible for bleeding in Mallory-V syndrome. Yes, you know, very good. Soni Adesh Kumar. Soni Adesh Kumar, it is left gastric artery. So this is left gastric artery. Very good. Left gastric artery. Next question. Investigation of choice for diagnosis of watermelon stomach. Watermelon stomach is also known as GAVE, gastric antral vascular ectasia. Tell me guys, what's the investigation of choice? Watermelon stomach. What's the investigation of choice? Yes, very good. You know, it is endoscopy, cap media, endoscopy plus biopsy. What will you find on endoscopy? On endoscopy, there are parallel stripes of vessels located at the antrum, and on biopsy, you are going to find ectasia. And the treatment is argan plasma coagulation. Next, what is the most common route of spread in Krukenberg tumor? In Krukenberg tumor, in carcinoma stomach, there is involvement of bilateral ovary. Can you tell me what's the route of spread? So, most common route of spread. Yes, it's retrograde lymphatic. Very good. Let me check. Avinash Jangid, it is retrograde. It is not transcoelomic transperitoneal. That's not most common. This is retrograde lymphatic. So, this is what? This is retrograde lymphatic. So, this is retrograde. So, this is retrograde lymphatic. Clear? Next, what is the drug of choice for unresectable gist or the first line agent for unresectable gist? Easiest question, guys. First line agent for unresectable gist. Easiest question. Tell me. First line. Very good. Faz, Faz, Bal, Bulbul, Cute, Arvind. It is imatinib. So, drug of choice for first line agent, that is imatinib. Can you tell me what is the second line agent? Yes, second line agent is sunitinib. And what is the third line agent? That is regorafenib. Third line, this is regorafenib. Regorafenib. So, third line is regorafenib, imatinib is Anita, sunitinib is Sunita. So, Anita, Sunita, first line, imatinib, and the second line is Sunita, sunitinib. Can you tell me what is the dyselectrolytemia in infantile hypertrophic pyloric stenosis? There is loss of potassium, loss of HCl. Yes, loss of potassium, loss of HCl. So, what is the dyselectrolytemia? Hypokalemia, hypochloremia, metabolic, yes, alkalosis with paradoxical aciduria. Very good. So, what is this? This is hypokalemia. Patient is having hypokalemia. There is hypochloremia. So, hypokalemia, hypochloremia, metabolic alkalosis. Hypochloremia. The patient is having metabolic alkalosis with paradoxical aciduria. So, metabolic alkalosis with paradoxical aciduria, This is one of the famous question almost asked every year. Every year this question is asked in each and every paper. So, classical finding: hypokalemia, hypochloremia, metabolic alkalosis with paradoxical aciduria in infantile hypertrophic pyloric stenosis. Clear? Next question. Tell me what is the most common site of stress gastritis or stress ulcer? Easy question, guys. Tell me. Most common site of stress gastritis, Saikat Ghosh, you are absolutely correct. Sakshi Kumari, correct. Most common site of stress ulcer, very good. Janvi, Jaswini, Jitendra Bajia, it is fundus. So, stress gastritis or stress ulcer, the most common site is fundus, means it's stomach, fundus. Next, there is diagnostic criteria of SBP. Obviously, there should be neutrophils. So, neutrophils and what? Monomicrobial growth. Guys, can you tell me the number of neutrophils? Neutrophils, and there should be monomicrobial growth. So, what happens? We have to go for paracentesis. We are aspirating the acidic fluid, and after that we are sending it for examination. Can you tell me number of neutrophils? More than. Avinash Jangir is first person to reply correctly. Neutrophils more than 250 per mm cube. So, this is the diagnostic criteria on paracentesis. Neutrophils more than 250 and monomicrobial growth on culture and sensitivity, Next, treatment of choice for perforation peritonitis. Easy question. Treatment of choice for perforation. So whenever any patient who is having perforation peritonitis, first resuscitate the patient. So IV fluids. When patient is fully resuscitated, then we take the patient for laparotomy. So it is IV fluids followed by exploratory laparotomy. IV fluids, so resuscitate the patient plus followed by exploratory laparotomy. Directly we are not taking the patient for laparotomy. So it is IV fluids followed by exploratory laparotomy. Next question, what is the most common site of intraperitoneal abscess? One of the frequently asked questions. Most common site of intraperitoneal abscess. Guys, tell me. Very good. Pelvis. Vinay Kumar, pelvis, pelvis, pelvis. Very good. It is pelvis. This is pelvis. Next, what is the triad of mesenteric cyst? Can you tell me the name? Triad. Mesenteric cyst triad. Mesenteric cyst triad, guys. Yes. Mesenteric cyst triad, what's the name? First person, Ansh Chawla, this is Tilak's triad. Tilak's triad. So guys, what are the components of Tilak's triad? There is soft fluctuant swelling in periumbilical region, moving perpendicular to attachment of mesentery and zone of hyperresonance around the swelling. What is the name? Tilak's triad, seen in mesenteric cyst. Next, what is the most common cause of large bowel obstruction? Tell me guys, large bowel obstruction, it is adhesions or malignancy? Most common cause of large bowel obstruction. Okay, Kanhu Charandas wants to ask what is Tilak sign. So swelling moving perpendicular to attachment of mesentery, that is known as Tilak sign. And if you include three components, soft fluctuant swelling, moving perpendicular to attachment of mesentery and zone of hyperresonance around the swelling, this is triad. And only thing moving perpendicular to attachment of mesentery, that is known as Tilak sign. Right? So most common cause of large bowel obstruction, let me see, first person to reply correctly. Smruti Shripati, guys, it is not adhesions. For small bowel obstruction, it is adhesions. For large bowel obstruction, it is malignancy. So for large bowel obstruction, it is malignancy. For small bowel obstruction, this is adhesions. Next, claw sign, coiled spring sign on barium enema. It is seen in which condition? Claw sign, coiled spring sign on barium enema. It is seen in which condition? Easiest question, intussusception. So very good. Vinay Kumar, cap media, this is intussusception. So this is intussusception. So that's intussusception. Okay. Next, coffee bean sign and bent inner tube sign on X-ray. Omega sign. Coffee bean sign, bent inner tube sign on X-ray. Omega sign, it is seen in which patient? Everybody is correct. Everybody, Vibha Roy, Jaswini, Pratik, Monica, Smruti, Arvind, Sab, Sidhu, Holy Treasure, Sunny Reddy, everybody sigmoid volvulus. Everybody is correct, guys. It is sigmoid volvulus. Clear? Next, what is the most common ectopic mucosa in Meckel's diverticulum? Meckel's diverticulum, what is the most common ectopic mucosa? Yes, gastric. It is gastric followed by pancreatic followed by colonic. So how to remember? It is GPC. Gastric followed by pancreatic followed by colonic. So that's gastric. GPC followed by pancreatic. So it is gastric followed by pancreatic followed by colonic. So gastric followed by pancreatic followed by colonic, that is GPC. It is GPC. Clear? Next, thickened and patulous IC valve with narrow terminal ileum on barium will follow through. Thickened and patulous IC valve with narrow terminal ileum on barium will follow through in GI tuberculosis. What is the name of this sign? Let me see who is the genius over here. This was asked in NEET PG. Thickened and patulous IC valve with narrow terminal ileum on barium will follow through in patients of GI tuberculosis. It is seen in which condition? This is not string sign, guys. Inverted umbrella. Jaswini, you are correct. Inverted umbrella. Can you tell me the name of this sign? Inverted umbrella. What's the name of this sign, guys? Yes, Fleischner's. Sangeeta Bishwas, you are correct. It is Fleischner's sign. So what? This is inverted umbrella sign. This is also known as Fleischner's sign. This is known as Fleischner's sign. What is the other name? This is also known as inverted umbrella sign. Clear? So that's inverted. So that's inverted umbrella sign. Inverted umbrella sign. Clear? Next, maximum risk of dyselectrolytemia is seen in which type of enterocutaneous fistula? Location. Tell me. Stomach, duodenum, jejunum, ileum. There is maximum risk of enterocutaneous fistula. Tell me, guys, when the fistula is in which organ? Fistula is in which organ? Yes, this question was also asked in one of the latest exam. Duodenum. Let me tell you, proximal fistulas are having higher risk of dyselectrolytemia. So in small intestine, what is the proximal part? Duodenum, followed by jejunum, followed by ileum. So maximum risk in duodenal fistula. In duodenum, followed by jejunum, followed by ileum. So there is maximum risk in proximal fistulas, duodenum. Next, what is the investigation of choice for diagnosis of small bowel carcinoid? You know the answer. Small bowel carcinoid. Investigation of choice, guys, tell me. Easy question. Small bowel carcinoid. Again, we are doing the assessment. No, we are doing the assessment in the urine. Yes, there is one substance you are going to detect in urine, 5-HIAA. So it is 24 hours urinary estimation of 5-hydroxy-indole acetic acid. So it is 5-hydroxy-indole acetic acid. 24 hours urinary estimation of 5-HIAA. Every year this question is asked. Next, investigation of choice for diagnosis of Hirschsprung's disease. Guys, tell me. Hirschsprung's disease, investigation of choice, all of you know. There is aganglionosis. Aganglionosis. So absence of ganglion cells, most common site rectum. So obviously what we do? Biopsy. Dr. Max, very good. We do rectal biopsy. So what kind of biopsy we are doing, guys? Rectal biopsy. Next question. Sawtooth appearance. This kind of appearance. If you do barium enema, there is sawtooth appearance. Sawtooth appearance. So sawtooth appearance on barium enema is seen in. Sawtooth appearance on barium enema is seen in. Yes, very good. Diverticulosis. Dr. Max. Prajwal K18. Very good. Vinay Kumar. Arvind Sab. Anil. Sakshi Kumari. Yes, this is colonic diverticulosis. This is colonic diverticulosis. Diverticulosis. Next easy question. Treatment of choice for familial adenomatous polyposis. Guys, tell me. Treatment of choice. There is increased risk of malignancy in rectum and followed by colon. 100% risk of malignancy is there. Remove both of these organs. So can you tell me? Treatment of choice. Yes, resection, anastomosis. Romano, Zlatan, give me the exact answer. Raju Kanan, very good. Total proctocolectomy, and after total proctocolectomy we go for ileal pouch anal anastomosis. So guys, it is TPC. Total proctocolectomy plus ileal pouch anal anastomosis. So it is TPC, total proctocolectomy plus ileal pouch anal anastomosis. Clear? Next, most common extra-intestinal malignancy in HNPCC. HNPCC is also known as Lynch syndrome. Hereditary non-polyposis colorectal cancer. Guys, tell me, most common extra-intestinal malignancy. Most common extra-intestinal malignancy. I'm waiting for your reply. Yes. Yes. Very good. Dr. Max, very good. Endometrium, followed by gastric, followed by ovarian. So how to remember, mnemonic is ego. You should keep your ego to minimum level if you want to get success early. So ego, that's endometrial, followed by gastric, endometrial, followed by gastric, followed by ovarian. So it is endometrial, followed by gastric, followed by ovarian. So endometrial, followed by gastric, followed by ovarian. So that's the most common extra-intestinal malignancy in HNPCC. Clear? Next, chemotherapy regimen for colorectal cancer. Guys, tell me. It is same in carcinoma colon and carcinoma rectum. What is the name of that regimen? Chemotherapy regimen in colorectal cancer. Easy question. Guys, tell me. Chemotherapy regimen. Yes? Let me see. Jaswini, you are the first person to reply correctly. It is FOLFOX. So that is FOLFOX 4. It is FOLFOX 4. Fol, you know that this is folinic acid. So folinic acid also known as leucovorin. So this is folinic acid. This is also known as leucovorin. F, this is 5-fluorouracil, and ox, that is oxaliplatin. So 5-fluorouracil, oxaliplatin. Ox, that's oxaliplatin. Next, what is the most common site of ischemic colitis? Ischemic colitis, most common site. Kanu Charandas, tell me. Sangeeta Bishwas, Vinay Kumar, most common site of ischemic colitis. Ischemic colitis, Jaswini, very good. It is splenic flexure of colon. So that is splenic flexure. So this is splenic flexure of colon. Guys, splenic flexure of colon. Right? Next, accordion sign on CCT is seen in which condition? You know, accordion, one instrument is there. So accordion sign on CCT is seen in which condition? Accordion sign. First person Ansh Chawla, second Soumya Raj. Guys, it is pseudomembranous colitis, and you know the organism responsible, Clostridium difficile. So this is pseudomembranous colitis, accordion sign on CCT. Accordion sign on CCT, pseudomembranous colitis. Next, most common, this is one of the famous question, most common early complication of ileostomy. Guys, early complication, most common early complication, this is famous question of INI-CET. Multiple times this was asked in exam. Most common early necrosis, very good, it is ischemia or necrosis. It is ischemia or necrosis, right? And if the question is asked most common complication, then it is skin irritation, that is dermatitis. Clear? Next, what is the most common site of fistula? Most common site of perforation, most common site of carcinoma in Crohn's disease patient. In Crohn's disease patient, most common site of fistula, perforation, carcinoma. Yes, Sidhu Swami, very good Sidhu Swami, you are correct, it is ileum. In Crohn's disease, maximum there is involvement of ileum. What happens? There is ulcer, there is stricture, there is perforation, there is carcinoma, fistula, so it's ileum. Next, what is the most common complication in ulcerative colitis after this surgery? Total proctocolectomy plus ileal pouch anal anastomosis. Most common complication in patients of ulcerative colitis after total proctocolectomy plus IPAA, ileal pouch anal anastomosis. Yes, guys, let me tell you, if you perform total proctocolectomy plus ileal pouch anal anastomosis in FAP patient, there is small bowel obstruction. But in ulcerative colitis, what happens? Yes, no. In ulcerative colitis, there is inflammation because there is inflammatory bowel disease. This is inflammatory bowel disease, so there is inflammation. So there is inflammation of pouch. Ansh Chawla is correct. Pouchitis. Saikat Ghosh, this is pouchitis. So this is pouchitis followed by small bowel obstruction. Next, appendicular lump. You are going to manage appendicular lump conservatively. Guys, tell me what's the name of this regimen? Appendicular lump management, conservative management, and almost everybody is correct. What? We go for Ochsner-Sherin regime. So what we go for? We go for Ochsner-Sherin regime. So we go for Ochsner-Sherin regime. Clear? So this is Ochsner-Sherin regime. How to manage appendicular lump conservatively, that is Ochsner-Sherin regime. Clear? Next question. So next question, muscle cutting incision. All incisions, almost all incisions in appendectomy are muscle splitting. Only one is muscle cutting. Tell me the name. Muscle cutting incision. Guys, muscle cutting. Muscle cutting incision. Halogen. Dr. Max, very good. Very good. It is, no, it is not Gridiron, it is Rutherford Morrison. So what's the name? This is Rutherford. So this is Rutherford Morrison incision. So this is Rutherford, so Rutherford Morrison incision. So that's Rutherford Morrison incision. Next, what is the most common complication of hemorrhoidectomy? So if you perform hemorrhoidectomy, patient will be having pain, and because of pain there is urinary retention. So it is pain. Pain leads to urinary retention. Urinary retention. Clear? So it is pain. If pain is not given in the option, go for urinary retention. Next, rectopexy can be done via abdominal approach, via perineal approach. Guys, tell me, in elderly and frail patient, which rectopexy is preferred, abdominal or perineal? Waiting for your reply. Yes, preferred rectopexy in elderly and frail patient. Yes, very good. Avinash, very good. It is perineal. So perineal because there is lesser morbidity. In abdominal, there is higher morbidity but lesser recurrence rate. So here we prefer perineal. So what is this? We perform perineal rectopexy. In elderly and frail patient, perineal rectopexy. Next, can you tell me what is the most common type of fistula in ano? Type 1, intersphincteric. Type 2, transsphincteric. Type 3, suprasphincteric. Type 4, extrasphincteric. Intersphincteric, transsphincteric, suprasphincteric, extrasphincteric. Tell me which one? We discussed that whenever a classification starts from 1, 2, 3, 4, 5, what is the most common type? 1. So guys, tell me here, intersphincteric, transsphincteric, suprasphincteric, extrasphincteric. Yes, everybody is correct. Type 1, that is intersphincteric. Very good. Arvind, Vinay, it is type 1. So that's type 1. And you know that, guys, type 1 is intersphincteric. This is intersphincteric. Clear? So this is intersphincteric. Next, what is the most common site of fissure in ano? In fissure in ano, what is the most common site? Suppose this is the clock and then tell me, this is the clock. Which o'clock position? 12 o'clock, 3 o'clock, 6 o'clock, 9 o'clock. Most common site of fissure in ano. Easiest question. First person to reply correctly, halogen and Dr. Max, posteriorly in the midline, 6 o'clock. So this is, guys, posteriorly in the midline, and that is 6 o'clock. So it is posteriorly in the midline, this is 6 o'clock. So this is 6 o'clock position. Okay. Next, resectable tumor in rectum located 6 centimeter from anal verge. So any tumor which is located more than 5 centimeter from anal verge, you can go for LAR. And what is LAR? That is low anterior resection. Because distally in the rectum we need 2 centimeter margin. So we go for LAR. And if a malignancy is located at or below 5 centimeter from anal verge, in that case we do APR. And what is APR? That is abdominoperineal resection. So here, Sidhu Swami, you are correct. Only person to reply for this question, Sidhu Swami. We perform LAR, low anterior resection. That is low anterior resection. Next, guys, easiest question, you have to tell me treatment of choice for carcinoma anal canal. Carcinoma anal canal is squamous cell carcinoma. What's the treatment of choice? Tell me. Treatment of choice for carcinoma anal canal. Yes, squamous cell carcinoma. Tell me the treatment of choice for carcinoma anal canal. Yes, guys. Very good, Arvind. It is chemoradiation. And what's the name? Nigro regimen. So this is Nigro regimen, and we go for chemoradiation. So Nigro regimen, what we go for here? We go for chemoradiation. So this is Nigro regimen, we go for chemoradiation. So that's chemoradiation. Is the chemoradiation. Nigro regimen, we go for chemoradiation, 5-FU plus mitomycin C. Next, best time for platelet transfusion in patient of splenectomy. If patient is having ITP, yes, what is the best time for platelet transfusion? After ligation of splenic artery or after ligation of splenic vein? Tell me, guys. Somebody saying immediately after surgery. After ligation of splenic artery or vein? Yes, very good. Jaswini, you are correct. Vibhara, you are correct. After ligation of splenic artery, because whenever you want to give platelets, it should not reach spleen, because the moment you are giving platelets in the body, it will be coated by antibodies. And if it reaches spleen, spleen is going to destroy that. So whenever you ligate splenic artery, then you can transfuse it. So after ligation of splenic artery. This is after ligation of splenic artery. So after ligation of splenic artery. So after ligation of splenic artery. Clear? So it is after ligation of splenic artery. Next, what is the most common complication of splenectomy? Yes, guys, tell me. It is lung related complication. So what is the most common complication of splenectomy? That is not OPSI. That's the most common late complication. Yes, nobody replied correctly till yet. First person to reply correctly, Ansh Chawla, it is atelectasis or collapse. This is atelectasis or collapse, and you know atelectasis, important point. It's the cause of fever, non-infectious fever up to 48 hours. So the most common complication of splenectomy, that is atelectasis. Next, guys, can you tell me what is the most common type of hernia in females? Most common type of hernia in females. Easiest question, guys, tell me most common type of hernia in females. Easiest question. Let me see who's going to reply correctly. First person. First person is Ansh Chawla. Guys, it's not femoral. It's indirect hernia. Most common type of hernia in both males and females is indirect inguinal hernia. Femoral hernia is more common in females, but the most common type of hernia is inguinal. So most common type of hernia in both males and females, indirect inguinal. This is indirect inguinal hernia. This you have to remember. And the femoral hernia is more common in females. Next, what's the gold standard treatment for inguinal hernia? You have seen this surgery in OT, especially in the government hospitals. Gold standard treatment for inguinal hernia, guys, tell me. We use the mesh. What's the name of this repair? Jasmine, you are 100% correct, absolutely correct. This is what? Lichtenstein repair. So what's the name? This is Lichtenstein. So this is Lichtenstein repair. Clear? So Lichtenstein repair. Next, can you tell me content of triangle of doom? You can see this is triangle of doom. What are the boundaries? Medially, vas deferens, laterally, gonadal vessels, inferiorly, peritoneum, apex, deep ring. Apex, deep ring. Can you tell me, guys, what's the content? You can see content, there's a vein and there's artery. Which vein, which artery? Yes, so everybody is correct, guys. In triangle of doom, medially, vas deferens, laterally, gonadal vessels, apex, deep ring, and base, peritoneum, content, iliac vessels. That's why in this triangle, sharp dissection should not be done. Otherwise, if you do sharp dissection, what will happen? There is injury of iliac vessels leading to bleeding and death. Next, there is hernia through gap in lacunar ligament. What's the name of this hernia? Hernia through gap in lacunar ligament, and I'm giving you the hint. It starts with L. It starts with L. L. Hernia through gap in lacunar ligament. Yes, halogen 50. First person to reply correctly. Halogen. Very good, halogen. It is Logier's hernia. This is Logier's. This is Logier's hernia. Hernia through gap in lacunar ligament. That is Logier's hernia. Logier's. Okay. Next, hernia in which posterior wall of sac is formed by viscera. Tell me, guys, what's the answer? Posterior wall of viscera. Hernia in which posterior wall of sac is formed by viscera. Easy question. Yes, easiest question. Posterior wall of sac is formed by viscera. Yes, this is sliding hernia, also known as hernia inglicid. So this is known as sliding hernia. Sliding hernia, also known as hernia inglicid. That's also known as hernia inglicid. Clear, guys? So this is hernia inglicid. Hernia inglicid. Most of you are participating actively. That's very, very nice. And most of you are marking the correct answer. It means your preparation is up to the mark, guys. Keep it up. Keep it up. Clear? Keep it up. Keep it up, guys. Most of you are replying correctly. Clear? Okay, next, in omphalocele, abdominal content is covered inside by. There are two coverings. One is outside, one is inside. Clear? So what is covering inside? You know how to remember. Outside is amnion. So outside is amnion and inside is peritoneum. Inside is peritoneum. So outside is amnion, inside is peritoneum. What is the question? Covering inside. So how to remember? Peritoneum is in, mnemonic is pin. Pin, peritoneum is in. So guys, I hope you'll remember pin. Pin means peritoneum is in. So pin, peritoneum is in. So inside it is covered by peritoneum. Pin, peritoneum is in. So it is covered by peritoneum. Next, what is the treatment of choice for recurrent desmoid tumor? Recurrent desmoid tumor. For desmoid tumor, it's a mesenchymal tumor. We go for surgical excision, wide local excision. But if it's recurrent, to prevent the recurrence, what should be done? Jaswini, since it's recurrent, to prevent the recurrence, what should be done? Radiotherapy. So what we do? Excision, surgical excision plus radiotherapy. So we go for surgical excision plus radiotherapy. So not only excision, we have to give radiotherapy also. So it is surgical excision plus radiotherapy. That's the treatment of choice for recurrent desmoid tumor. Clear? Recurrent desmoid tumor. Okay, next, hardest renal stone. Easiest question, hardest. Let me tell you who is going to reply the correct. See who is going to reply correctly. What is the hardest renal stone? Not easily broken by ESWS. Hardest. Very good. Jaswini, Anil, Bijay Yadav, Avinash Jangir, Mahendra Krishna, Holy Treasure, Sangeeta Vishwas, Ram Chaudhary, everybody is correct. It is cystine stone. This is cystine. Cystine stones, these are hardest stone, not easily broken by ESWL. Next, suppose there is ureteric stone, where in the lower part of ureter, कैसे निकालेंगे? It should be treated by TB. How you are supposed to treat it? Lower ureteric stones are best treated by, or should be treated by, lower ureteric stone. Yes, Vibha Roy, ureteroscopy, that is URS. So how we have to take it out? By URS, ureteroscopy. Next question. You can see putty kidney, cement kidney. Putty kidney, cement kidney. Famous question. It is seen in which condition? Putty kidney, cement kidney. Seen in which condition? Yes, it is seen in renal tuberculosis. So putty kidney, cement kidney, seen in renal tuberculosis. Next, pulsatile secondaries. In the bones, there are pulsatile secondaries. Pulsatile means osteolytic and hypervascular. Pulsatile secondaries, osteolytic, hypervascular. Tell me, it is seen in which condition? RCC as well as follicular carcinoma thyroid. Very good. Kanhu, Charandas, Arvind Sab. Yes, very good. It is RCC and follicular carcinoma thyroid. So that is RCC and follicular carcinoma. So it is RCC and follicular carcinoma thyroid. Clear, guys? So this is RCC and follicular carcinoma thyroid. Pulsatile secondaries are seen in RCC and follicular carcinoma thyroid. Next, most common cause of death in ADPKD, autosomal dominant polycystic kidney disease. Most common cause of death. Guys, tell me, most common cause of death. Muhammad Anas, tell me, what is the most common cause of death in ADPKD? Easiest question. It is cardiovascular disorders. It is cardiovascular disorders. There is uncontrolled hypertension. So these are related to cardiovascular disorders. Cardiovascular disorders. Next question, easiest question. Gold standard treatment for PUJ obstruction. Gold standard treatment, guys. Gold standard treatment for PUJ obstruction. Easiest question. Gold standard treatment for PUJ obstruction. Anderson, very good. Irwin Sub. Yes, Anderson-Heinz dismembered pyeloplasty. So this is Anderson. This is Anderson-Heinz. This is Anderson-Heinz dismembered pyeloplasty. Clear? So this is Anderson-Heinz dismembered. So this is dismembered pyeloplasty. Okay? So this is Anderson-Heinz dismembered pyeloplasty. Clear? Anderson-Heinz dismembered pyeloplasty. And one easy question which everybody knows. Adder head or cobra head appearance on IVP. It is seen in which condition? Guys, tell me. Let me see who is the fastest. Fastest is Dr. DeBakey. Very good, Dr. DeBakey. You are the first person. Fastest, Dr. DeBakey, uretrosil. It is uretrosil. Uretrosil. There is adder head or cobra head appearance. Clear, guys? Adder head or cobra head appearance. Very good. Pratik Doshi. Very good. Monica. Lakshita Sharma. Very good. Everybody is correct. Next, most common primary bladder stone. Let me see who is the genius over here. Most common primary bladder stone, guys. Tell me the answer. Most common primary bladder stone. Tell me the answer. Yes. Lakshita Sharma. Very good. You are the first person to reply correctly. This is ammonium urate. It is ammonium urate, guys. It is ammonium urate. This is ammonium urate. Ammonium urate. Next, what is the most common cause of bladder calcification worldwide? Most common complication of bladder calcification worldwide. Easiest question. Bladder calcification worldwide. Jaswini, you are correct. It is schistosomiasis. That is schistosomiasis caused by schistosoma hematobium. So schistosomiasis. Next, investigation of choice for diagnosis of bladder rupture. Bladder rupture, inject the dye in the bladder, take CT. What is the name of this investigation? Bladder rupture. Bladder rupture, investigation of choice. Let me see who is the first person. Fastest. Ram Chaudhary, it is not IVP. Vijay Yadav, it is not CT. Tell me the complete name. Yes, tell me, complete name. Inject the dye in bladder and take CT. It is CT cystography. What's the name, guys? It is CT cystography or CT cystogram. So this is CT cystography or CT cystogram. Next, what is the most common site of carcinoma bladder? Bladder. Where exactly? Most common site. Let's see who is the fastest person here. Fastest finger. Yes. Most common site of carcinoma bladder. You know the answer, guys. You know the answer. Yes. Trigone. Jaswini, very good. Which wall of trigone? Which wall? Soumya Raj is the first person to reply correctly with complete answer. It is posterolateral wall of trigone. So that is posterolateral wall. So this is posterolateral wall of trigone. Clear? So it is posterolateral wall of trigone. Posterolateral wall of trigone. Clear? Next, chemotherapy regimen for metastatic carcinoma bladder. It is MVAC. You have to tell me the full form. Guys, MVAC. I'm telling you the short form. Tell me the full form. MVAC. Tell me the name of agents. MVAC. First, tell me M. M. Everybody is correct. M. Guys, M. Methotrexate. It is M. That is methotrexate. Right? Next, it is not vincristine. Yes, Muhammad Anas. It is vinblastine. Bladder. How to remember? Blastine. Bladder blastine. Bladder blastine. A. Adriamycin. Adriamycin and C. cisplatin. So A. Adriamycin and C. That is cisplatin. Clear? So it is methotrexate, vinblastine, adriamycin, cisplatin. Next, what is the most important landmark in TURP? In TURP, what is the most important landmark? Easiest question. Repeat question. It was asked multiple times. Easiest question, repeat question. It was asked multiple times, guys. Tell me. Verumontanum. Why? Because verumontanum is located just proximal to external urinary sphincter. So this is most important distal landmark. So this is verumontanum. What is this? Verumontanum. Why verumontanum? Because it is located just proximal to external urinary sphincter. So this is most important distal landmark. Next, what is the most common complication of TURP? Tell me guys, most common complication of TURP, easiest question. Most common complication of TURP, retrograde ejaculation, very good. It is retrograde ejaculation. So that is retrograde ejaculation. It is seen in 75% cases. So this is retrograde ejaculation. It is seen in 75%, followed by impotence 10%. Impotence, it is seen in 10%, followed by incontinence less than 1%. Followed by incontinence, and incontinence it is seen in less than 1%. Clear? So retrograde ejaculation followed by impotence followed by incontinence. Next, what is the most common site of carcinoma prostate? Which zone? Central zone, transition zone, peripheral zone. Most common site of carcinoma prostate, which zone? Yes, central zone, transition zone, peripheral zone. So it is peripheral zone. Which lobe? Posterior lobe. So this is peripheral zone. Peripheral zone, and which lobe? It is posterior lobe. So peripheral zone, everybody is correct, or posterior lobe. So it is peripheral zone. So it is peripheral zone or posterior lobe and posterior lobe. Clear? That's the most common site. Next question guys, most common congenital malformation of urethra. Easiest question. Most common congenital malformation of urethra. Tell me. Let me see who is the first person to reply correctly. Most common congenital malformation of urethra. Yes. No. It is not posterior urethral valve. Yes, war hater. Posterior urethral valve is the most common. It's exclusively an abnormality of male urethra. Hypospadias. Soumya, you are correct. This is hypospadias. So this is hypospadias. Next, there is keyhole sign on prenatal ultrasound. So keyhole sign on prenatal ultrasound. It is seen in posterior urethral valve. Why? Because the bladder will be distended. Why? Because there is obstruction in the posterior urethra. Next, what is the most common site of urethral injury? In urethra, which part of urethra is most commonly injured? Guys, tell me, which part of urethra is most commonly injured? Easiest question. Soumya Raj, Arunav, Raj Bongshi, Sangeeta Vishwas, Bijay Yadav, membranous. First person to reply correctly, Bijay Yadav. Very good, Bijay. It is membranous. So posterior urethral injury, and in that it's the membranous. It's the membranous urethra. So most common site of urethral injury, that is membranous urethra. After that, circumcision, it is sufficient in carcinoma penis, located at. You need only 2 centimeter margin. So in which case circumcision is sufficient? Obviously, if malignancy is located where? If malignancy is located where? Yes, malignancy is located where? Yes, guys, tell me, I'm waiting. Malignancy is located where? Yes, what is the location of malignancy? You have to cut it off. Glans, very bad, Anil. If it's in glans, you have to cut off the glans. Yes, it is prepuce because you have to excise the preputial skin. So what is the location of tumor or malignancy? It is prepuce. That's why here circumcision is sufficient. So if it's located in prepuce, here circumcision is sufficient. Clear guys? Next, investigation of choice for non-palpable undescended testis. You can't feel it. It means it is abdominal and you have to go inside the abdomen, search for the testis. Now tell me the investigation. You go inside the abdomen, search for the testis, tell me the investigation. Easy guys, tell me. Go inside, search. Very good. First person, Pratik Joshi. Very good, Pratik. Diagnostic laparoscopy. So what's the name? This is diagnostic laparoscopy. So this is diagnostic laparoscopy. Yes. Next, surgical exploration in testicular torsion should be done within. Previously, it was said that it should be done within 4 hours. Nowadays, it's changed. Surgical exploration in testicular torsion should be done. Previously, it was 4 hours. Nowadays, it is same in priapism and in cases of testicular torsion. Previously, it was 4 hours. Nowadays, it is 6 hours. So in priapism also, surgical intervention should be done within 6 hours. Or intervention should be done within 6 hours, and here in testicular torsion, surgery should be done within 6 hours. Next, in varicocele, can you tell me what is the location of pampiniform plexus of veins in relation to testis? Location of pampiniform plexus of veins in relation to testis. In relation to testis, what's the location? Location of, very good. Holy treasure is the first person to reply correctly. It is posterior and above. So this is posterior and above testis. Posterior and above testis. Next, can you tell me what is the most common bilateral testicular tumor? That is the most common secondary testicular tumor, and that is most common testicular tumor in elderly. So most common bilateral testicular tumor, most common secondary testicular tumor, and most common testicular tumor in elderly. It is not seminoma, guys. It is not seminoma. Seminoma is seen in young patient 30 to 40. It is lymphoma. Anshavla, very good. It is lymphoma. So this is lymphoma. That's the most common bilateral testicular tumor. That is lymphoma. So most common bilateral testicular tumor, that is lymphoma. Clear? Lymphoma. Next, most common symptom of peripheral arterial occlusion. Peripheral arterial occlusion, you know, if there is occlusion, obviously what's the problem? There is ischemia, and because of ischemia, what's the symptom? Guys, you know, what is the symptom? Most common symptom of peripheral arterial occlusion, you know. Pain, it is characterized by 5P, so most common is pain. There is pain, pallor, pulselessness, paralysis, paresthesia. So pain, pallor, paresthesia, paralysis, pulselessness, most common is pain. Next, Leriche syndrome. Let me see who's the genius over here. What is this Leriche syndrome? First tell me, what is this Leriche syndrome? Guys, it's very easy and very important question. Tell me. Leriche syndrome. Yes, Leriche. Very good. In Leriche syndrome, there is erectile dysfunction. Where is the obstruction? Aortoiliac bifurcation. So this is erectile dysfunction, and it is seen in obstruction of aortoiliac. So aortoiliac bifurcation, obstruction of aortoiliac bifurcation. This is Leriche syndrome, also known as erectile dysfunction. Next, most commonly involved vessels in Burgess. In Burgess disease, what is the most commonly involved vessels? Medium and small sized vessels. You tell me the name. Guys, tell me the name. Tell me medium and small sized vessels, tell me the name. I am telling you the mnemonic, it is TPR. Now tell me the full form. The vessels are TPR. Now tell me the full form. It is TPR, full form. Tibial, very good. Dr. Debeki, very good. It's tibial followed by plantar followed by radial. So that is tibial followed by plantar followed by radial. So tibial followed by plantar followed by radial. That's the most commonly involved vessel in Burgess disease. Next, most common cause of acquired AV fistula. Acquired. Overall, AV fistulas are congenital mostly. What is the most common cause of acquired AV fistula? Acquired. Kanhu Charandas. Yes. Jaswini, it is not iatrogenic. Acquired AV fistula. Yes. No. It is not iatrogenic. It is very good. Om Prakash Sharma, first person to reply. Trauma. And what kind of trauma? It is penetrating trauma. So what kind of trauma, guys? It is penetrating trauma. So what kind of trauma? This is because of penetrating. So it is because of penetrating trauma. So that's penetrating trauma. That's the most common cause of acquired AV fistula. Next, cutoff diameter. This is one of the famous question. Cutoff diameter for surgery in abdominal aortic aneurysm. Let me see who's going to reply correctly. Cutoff diameter for abdominal aortic aneurysm. This was asked multiple times in medicine as well as surgery. Guvera, Anshu Chawla, it is more than equal to 5.5 centimeter. So that's the cutoff diameter, more than equal to 5.5 centimeter. Next, most common site of subclavian artery stenosis. It is because of atherosclerosis. Guys, tell me the most common site of subclavian artery stenosis. Obviously, which part of subclavian artery and which type, which side of subclavian artery? Yes, which part and which side? First part, Arunav Raj Bongshi, you are correct. First part, which side? It is more common on left or right? First part, left. Very good. So most common site is first part of left subclavian artery. So it is first part of left subclavian artery. Next, what is the best graft for CABG? Coronary artery bypass grafting. Can you tell me, guys, what is the best graft? Best graft for CABG. CABG best graft. Best graft. It is not saphenous vein. Saphenous vein is most commonly used graft. Best is Naga Karthik, War Hater. It is Lima, that is left internal mammary artery. So guys, best graft It is lima, left internal mammary artery, and most commonly used graft, that is long saphenous vein. So it is lima. Next, what is the most common site of DVT? Easiest question. You know the answer. Tell me the correct answer, guys. Most common site of DVT. Yes, you know, it is calf or soleal vein. Very good. It is calf or soleal vein. Calf or soleal vein. And next question, most common site of DVT leading to pulmonary embolism, that is thigh vein or femoropopliteal vein. So that's thigh vein or femoropopliteal vein. Next, what is the gold standard treatment for varicose vein? Gold standard treatment for varicose vein. One of the famous question being asked nowadays, gold standard treatment for varicose vein, guys, tell me. Gold standard, this is endothermal ablation. First person to reply correctly, war hater, endothermal ablation. So that is endothermal ablation. Clear? So that's endothermal ablation. Okay, next, familial version of congenital lymphedema is known as. Familial version of congenital lymphedema is known as, this is the famous question and almost the only question which is asked in relation to lymphedema. Familial version of congenital lymphedema is known as, tell me guys. Yes, Milroy's. First person to reply correctly, Ansh Chawla, Naga Karthik, Milroy's. So that's Milroy's disease. It is Milroy's. So this is Milroy's disease. That's the Milroy disease. Next, what is the most common posterior mediastinal mass? Posterior mediastinal mass. Yes, most common. Thymoma annus, it is anterior. Thymoma is anterior. I am asking posterior. Om Prakash Sharma, you are the first person to reply correctly. Neurogenic tumor. It's neurogenic tumor. In anterior mediastinum, it is thymoma. Posterior mediastinum, neurogenic tumor. So posterior mediastinum, it is neurogenic tumor. Clear, guys? Next. After trauma, road traffic accident, there is presence of fat globules in sputum, urine. So fat globules are there in the sputum and urine, leading to, after RTA, leading to long bone fracture. Can you tell me what kind of embolism patient is having? That is fat embolism syndrome. Very good, Arvind Naga Karthik. It is fat embolism. So this patient is having fat embolism. The patient is having fat embolism. Fat embolism. Next, imagine you are going for X-ray. On X-ray PA view, what? You can see the flat surface of coin. On X-ray PA view, you can see the flat surface of coin. Can you tell me where is the coin? Yes, first person to reply correctly, Arvind Sab, Dr. Max, Mahendra Krishnan, Sunny Reddy, Dr. Mamoon Patil, esophagus. And if you can see the edge on PA view, it is in trachea. So what? It is in esophagus. What is the location? Location is esophagus. Esophagus. Next question, guys. Can you tell me what is the most common symptom of carcinoma lung? Most common symptom of carcinoma lung. Yes, Kanhu Charandas, it is cough. Cough. So how to remember? Cough followed by DCH. It is cough followed by DCH. DCH means dyspnea, C means chest pain, H means hemoptysis. So cough followed by dyspnea, followed by chest pain, followed by hemoptysis. So it is dyspnea followed by chest pain, followed by hemoptysis. So dyspnea, chest pain followed by hemoptysis, most common symptom, that is cough. It's cough. Next, degree of burn, there is involvement of subcutaneous fat. Easiest question, guys, tell me. In which degree there is involvement of subcutaneous fat? So this is full thickness burn. There is involvement of subcutaneous fat. Full thickness burn with subcutaneous fat involvement. Yes, which degree? Yes, third degree. So guys, it is third degree. It is third degree burn. So this is third degree burn. This is third degree. It is third degree burn. And suppose I am going to just switch the question. Patient is having pressure ulcer or pressure sore, and there is full thickness skin loss with subcutaneous tissue involvement. What is the stage? Third stage. So almost burn classification and staging of pressure ulcer, it is almost similar. It is almost similar. You know that what is first degree burn? There is epidermal burn, and first stage 1 of pressure ulcer or pressure sore, there is erythema of epidermis. In second degree, there is involvement of epidermis and dermis, and in stage 2, there is involvement of epidermis and dermis. In third degree burn, there is full thickness burn with involvement of subcutaneous fat, and in stage 3, full thickness Skin loss is there with involvement of subcutaneous tissue, and whenever underlying structure you can see apart from skin, you can see muscle, bone or brain, that is 4th degree burn. And stage 4, whenever you can see underlying muscle, bone, this is stage 4. So it is very similar. Next, how much is the minimum urine output? Minimum urine output after adequate tissue perfusion in adults. Guys, tell me, in adults, how much would be the minimum urine output? After adequate tissue perfusion. Yes, 1 ml per minute. Very good. It is 1 ml per minute. So that's approximately 60 ml per hour. So 1 ml per minute. Next, what is the skin malignancy which is characterized by ABCDE? ABCDE means asymmetry, border irregularity, color variation, change in diameter more than 6 mm, and E evolution in size, shape and color. ABCDE. Which malignancy? First person to reply correctly, it is Anil. Anil, very good. It is melanoma. That is melanoma, malignant melanoma. Next, what is the most common site of keloid? You know, guys, that it is more common in darkly pigmented races. What is the most common site? Most common site, Muhammad Anas. This time you are absolutely correct, Muhammad Anas, sternum. You are the first person to reply correctly this time, and you are absolutely correct. It is sternum. Sternum. Pooja, you are correct. Pia, you are correct. Krishna Kumar, yes, you are correct. It is sternum. Okay. Next. Stage of pressure ulcer. Guys, I am repeating the question. You have to tell me the answer. Stage of pressure ulcer is full thickness skin loss extending into subcutaneous tissue. We discussed just now. Stage of pressure ulcer, full thickness skin loss extending into subcutaneous tissue. Ramit Raj, very good. Ramit, Dr. Ravi, Anas, Priya, Sidhu Swami, Om Prakash Sharma, Mahendra Krishnan, Soumya Raj, Dibeki, Sudha Shah, Kumar Akash, Dr. Neb, Sangeeta Vishwas, everybody is correct. It is stage 3. Guys, it is stage 3. So this is what? This is stage 3. Stage 3. Stage 3. Negative pressure used in vacuum assisted closure or negative pressure wound therapy. Tell me how much is the negative pressure? Negative pressure used in vacuum assisted closure or negative pressure wound therapy. R.K. Chaudhary, very good R.K. Chaudhary, fastest. Anil, very good. Vibha, it is minus 125 mmHg. Minus 125 mmHg. So this is negative pressure wound therapy or vacuum assisted closure. Okay, guys. Next, you can see SDH, subdural hematoma, is caused by injury of which vessels? Subdural hematoma is caused by injury of which vessels, guys? Tell me. Subdural hematoma. You know the answer. Yes, Vipul Joshi. Yes, again, it's the fastest finger question. And Ghulam Mustafa, incorrect answer. Ramit Raj is the first person to reply correctly. Bridging veins or cortical veins. It's because of injury of bridging or cortical veins. So it's because of injury of bridging veins or cortical veins. So bridging or cortical veins. Bridging veins or cortical veins. Some patient is going to describe after some kind of cerebrovascular accident that, sir, this is the worst headache of my life. Can you tell me in which cases, in which hemorrhage there is worse headache? Subarachnoid hemorrhage, very good. Kanhu Charadas, worst headache of life is seen in subarachnoid hemorrhage. Next question, investigation of choice for diagnosis of diffuse axonal injuries. These are patients of road traffic accident who are in vegetative state, unconscious state. You go for NCCT, it's normal. So guys, can you tell me what is the investigation of choice? Anshu Chawla, Ansh Chawla, Ramit Raj, all of you are correct, guys. Ramit Raj, Vibha Roy, Kumar Akash, Krishna Kumar, Dr. J. Jav, Pooja, very good Pooja, Usman Ghani, Priya, Sudha Shah, all of you are correct, it's MRI. Can you tell me what is the most common type of astrocytoma in children? Most common type of astrocytoma in children. In children, what is the most common type of astrocytoma? Yes, first person to reply correctly, it's Manendra Krishnan. Manendra Krishnan, it is pilocytic, and this is low grade astrocytoma, and you know that pilocytic astrocytoma is having best prognosis among astrocytomas. Clear? Next, dural tail sign, sunray spicules are seen in which brain tumor? Dural tail sign, sunray spicules are seen in which brain tumor? Let me see who is going to reply this answer correctly. Yes, Vipul Joshi, you are the fastest person, meningioma. First person to reply, Vipul Joshi, that is meningioma. Next, guys, easiest question, what is the most common brain tumor? Sindhuja Vasu, you are also correct. Dr. Jav, Priya, Rohit, Paladia, Anu Charanda, Sidhu, Usman Ghani. Tell me what is the most common brain tumor? Yes, most common brain tumor, Ansh Chawla, that is metastasis. It is metastasis or secondaries followed by glioma. So that's metastasis. Okay. Next, central necrosis and ring-like enhancement on MRI. In which brain tumor there is central necrosis and ring-like enhancement? This tumor is also known as butterfly tumor. No. Holy treasure, you are absolutely correct and the first person to reply. This is glioblastoma multiforme, GBM. This is also known as butterfly tumor. There is central necrosis with ring-like enhancement. Clear? So, central necrosis with ring-like enhancement, butterfly tumor, that is glioblastoma multiforme, guys, glioblastoma multiforme. Next, what is the most common flap used in reconstruction of head and neck defects? Tell me. Most common flap used in reconstruction of head and neck defects. Reconstruction of head and neck defects. Head and neck defects, reconstruction. Yes, it is PMMC flap. Now tell me the full form. This is PMMC flap. PMMC, that is pectoralis major myocutaneous flap. Next, tell me, it is based on which artery? Pectoralis major myocutaneous flap. So it is based on which artery? Pectoralis major myocutaneous flap, based on pectoral branches of thoracoacromial vessels. So it is based on pectoral branches. So pectoral branches of thoracoacromial vessels. Clear? Thoracoacromial vessels. Next, if we are going for lip reconstruction, we are using a flap based on the superior lip, Abe Islanders flap. Can you tell me it is based on which artery? I am going to take it from superior lip. So tell me, what is the name? Superior lip. Yes. What is the name? It is based on which vessel? Inferior labial artery or superior labial artery? Based on inferior labial artery or superior labial artery? Yes, superior labial artery, guys, it is superior. So this you have to remember, it is based on superior labial artery. Superior labial artery. Next, what is the most common salivary gland tumor? Easiest question, most common salivary gland tumor. Let me see who is the fastest finger here. Who has the fastest finger here? Pleomorphic adenoma, Sidhu Swami. Very good, Sidhu Swami. This is pleomorphic adenoma. This is pleomorphic adenoma. Pleomorphic adenoma. Next question, you tell me, guys, what is the most common site of salivary gland stone? It is most common in which salivary gland? Salivary gland stone, also known as silolithiasis. Most common type? Yes, it is calcium oblique magnesium phosphate oblique carbonate. What is the most common site? Which gland? Jaswini, you are correct. Yes, first person, Vipul Joshi. First person is Vipul Joshi. It is submandibular gland. And you know that 80% of salivary gland stone, it is radio opaque. Next question, guys, easy question. Ranula, it is located just below tongue in the floor of mouth. It is related to salivary gland. I told you the answer also. Just below tongue in the floor of mouth. So it is in relation to which gland? Yes, Vipul Joshi, first person to reply correctly, sublingual gland. So it is in relation to what? Sublingual gland. So in relation to sublingual gland. Next, there is Liar sign on angiography. Liar sign on angiography. It is seen which tumor? What is Liar sign? There is splaying of carotid. So obviously the tumor is arising from carotid. Guys, can you tell me the name? Carotid body tumor. Very good, Anil. Carotid body tumor. First person to reply, Arnav Raghubanshi, Raj Gobanshi. That is chemodectoma. Carotid body tumor. It is also known as chemodectoma. Chemodectoma. Next question, guys. What is the most common site of cystic hygroma? Cystic hygroma is brilliantly translucent swelling in the neck. Where is the location? Neck, Anil. Where exactly in the neck? Where exactly in the neck? Neck exactly where? Posterior triangle. Om Prakash Sharma, first person to reply correctly. It is posterior triangle of neck. So where exactly? This is posterior triangle. So it is posterior triangle of neck. It is posterior triangle of neck. So that's the most common site of cystic hygroma, posterior triangle of neck. Clear? Next, what is most commonly injured nerve in sentinel lymph node biopsy of breast cancer? Most commonly injured nerve in sentinel lymph node biopsy of breast cancer. Tell me, guys, this is one of the very good first person to reply correctly, Dr. Max. It is intercostobrachial nerve. This is very, very important. This is intercosto. So that is intercostobrachial nerve. So this is intercostobrachial nerve. Intercostobrachial nerve. Next question, what is the most common type of soft tissue sarcoma? Most common type of soft tissue sarcoma, guys, tell me most common type of soft tissue sarcoma. Easiest question. Yes, Naga Karthik, very good, liposarcoma, followed by leiomyosarcoma. So this is liposarcoma followed by leiomyosarcoma. Next, first line agent for DFSP is the same which is used in GIST. It is the same which is used in CML. GIST, CML and DFSP agent is same. Guys, tell me the name. Let me see who's the first person to reply correctly. Priya, tell me. Sangeeta Vishwas, Dr. Max, imatinib, Nikita Chaudhary, very good Nikita, very good Naga, Ansh, Vibha, everybody is correct. What? It is imatinib. So first line agent, it is imatinib in DFSP, in GIST as well as CML. Next, what is the type of graft in identical twins? If you take graft from identical twins, what's the name? What's the name of this graft, guys? Name isograft. So if you take it from identical twins, the name it is isograft. So name of this graft, this is isograft. Name, that is isograft. So type of graft in identical twins, that is isograft. Next, most common indication of pediatric liver transplantation. Pediatric liver transplantation, guys, easiest question, tell me. First person, Avinash Jangir, it is extrahepatic biliary atresia. So that is extrahepatic biliary atresia, that's the most common indication of pediatric liver transplantation, extrahepatic biliary atresia. Next, this question is asked almost every year, tension pneumothorax. What is the best location of needle insertion? So best location of needle insertion in tension pneumothorax in adults. Best location of needle insertion in tension pneumothorax in adults. Yes, fifth intercostal space in anterior axillary line, and that's the place for ICD insertion. So it is fifth intercostal space. Fifth intercostal space. Very good, Anil. Fifth intercostal space. Ram Chaudhary, Kumar Akash, 133 Ankit in anterior axillary line. Vibha Roy, very good, in anterior axillary line. Anterior axillary line. Clear? In trauma patients, according to trauma transfusion protocol, we have to give packed cell, plasma and platelets. In which ratio? Very good. Everybody is marking correct answer. Vibha Roy, Aruna Raj Gobanshi, Nikita Chaudhary, Rohit Paladia, Vipul Joshi, Khushi Singla, Yogendra Khati, Ramit Raj, Priya, Sudha, Kumar Akash, everybody is correct. It is 1:1:1. So that's 1:1:1. And can you tell me GCS components, eye opening, verbal response and best motor response. So out of these three, which one is best predictor of survival? Tell me, guys. Yes, best predictor of outcome, best predictor of outcome. It is best motor response, so very good. How to remember best predictor? It is best motor response. Examiner will not give this term best. So examiner will not give this term best, so it is motor response. Clear? Next, minimum number of people required for log roll. Log roll means examination of back. Ideal number of people 5 and minimum number of people required. Anushka Patricia, first person to reply. Anil, second, 4. Ideal number of people required 5, minimum number of people required 4. Clear? It is 4. Next, guys, first investigation done in blunt trauma abdomen patient. I think everybody knows the correct answer. Tell me, let me see who's the first person to reply correctly. First investigation done in blunt trauma abdomen. First, Anil, very good. Ramit Raj is fast. And if stable patient is there, gold standard investigation CCT. Can you tell me, guys, what are the components of trauma triad of death? I'm telling you the mnemonic, tell me the full form. Hypertrophic cardiomyopathy. Trauma triad of death, HCM. Now tell me the full form. Hypothermia, Anushka Patricia, very good. Hypothermia, C. Very good. Coagulopathy, HNM, metabolic acidosis. Holy treasure, first person to reply correctly. So hypothermia. It is hypothermia, coagulopathy. So that's coagulopathy and metabolic acidosis. So hypothermia, coagulopathy and metabolic acidosis. Metabolic acidosis. Clear? So that's the trauma triad of death. What is the investigation of choice for diagnosis of tension pneumothorax and flail chest? Guys, tell me. Investigation of choice for diagnosis of tension pneumothorax and flail chest. Yes. Anushka Patricia. Very good, Anushka. First person to reply correctly. Guys, it is not chest x-ray. It is not CT. If you send a patient for chest x-ray or CT, you will just get the chest x-ray. Your patient will not, be alive. You're getting the body of the patient. Means what? It's a clinical examination. Because it's life-threatening situation. That's why in tension pneumothorax as well as in flail chest, it's a clinical examination. Clinical. Next, what is the needle used for creating pneumoperitoneum? This was asked almost every year in each and every exam. What's the name of needle used for creating pneumoperitoneum? Let me see the first person to reply. Dr. Max, Viris needle. This is Viris needle. What's the name? It's Viris needle. Next question, what is the most commonly performed bariatric surgery worldwide? Previously it was RYGB. Previously it was Roux-en-Y gastric bypass, but nowadays it is Previously it was Roux-en-Y gastric bypass previously, but nowadays holy treasure, it is sleeve gastrectomy. So nowadays it is sleeve gastrectomy. Nowadays it is sleeve gastrectomy. Sleeve gastrectomy. Clear? What is the suture used for subcuticular suturing? Tell me the name of suture. Plastic surgeons are using it. So name of suture for subcuticular suturing. Guys, name of suture for subcuticular suturing. Yes, that's monocryl. It is monocryl. So name of suture for subcuticular suturing, that is monocryl. That is polyglycaprone. Polyglycaprone. Monocryl. Okay. What is the suture used for vascular anastomosis? Vascular anastomosis, guys, vascular anastomosis. It's not vicryl Khushi, it's not vicryl. Vascular anastomosis. Nobody replied correctly till now. First person Jaswini, second is Holy Treasure. We go for proline, guys. For vascular anastomosis, we use proline. So we use proline. We are going to use proline. It's proline. Clear? Next, suture length to wound length ratio. Whenever we are performing the suturing, how much should be the length ratio of suture length to wound length ratio? This is known as Jenkins rule. So this is known as Jenkins rule, guys. Jenkins rule. Suture length to wound length ratio, Dr. Max, 4:1. So this is 4:1. And what's the name? This is known as Jenkins rule. So this is known as Jenkins rule. 4:1. Next, what is the most common hospital acquired infection? Easiest question, guys. Most common hospital acquired infection. Most common hospital acquired infection. UTI. Vibha Roy, very good. UTI. Can you tell me the organism responsible? So obviously for UTI organism, it is E. coli followed by Klebsiella. So it is E. coli followed by Klebsiella. So organism is E. coli followed by Klebsiella. What is the best time to give prophylactic antibiotics? Whenever we are taking the patient for surgery, what is the best time to give prophylactic antibiotic? At the time of induction or 1 hour before surgery? So it is at induction. It's the best time at the induction or 1 hour before surgery. So 1 hour before surgery. So at the time of induction or 1 hour before surgery. Clear? 1 hour before surgery. Next, what is the preferred vein for TPN? Total parental nutrition preferred vein. Preferred vein for total parental nutrition, guys, tell me. Preferred vein. Very good. Yes. First person is Mani Prasad. Mani Prasad, very good. It is subclavian vein followed by internal jugular vein followed by femoral. So that is subclavian vein followed by internal jugular vein followed by femoral. Next, what is the most common complication of central venous catheterization? Most common complication of central venous catheterization, that is catheter related sepsis. So this is infection, catheter related sepsis. So this is catheter related sepsis. Clear? How much is the amount of blood loss in class 2 hemorrhagic shock? Guys, class 2 hemorrhagic shock, how much? Very good, 15 to 30. It is 15 to 30. In class 1, 0 to 15, class 2, 15 to 30, class 3, 30 to 40, class 4, more than 40. So it is class 2, 15 to 30. Next, type of shock which is characterized by hypotension and bradycardia. Shock in which there is hypotension and bradycardia. Yes? No. Guys, in hypovolemic, there is hypotension and tachycardia. Here it is hypotension and bradycardia. First person to reply correctly, Vibha Roy, and second person is Kanhu Charan Das. What happens? It is neurogenic. Why? Because there is loss of sympathetic tone, and because of this loss of sympathetic tone, what happens? Pulse rate is low. Warm peripheries are there because of venous and arterial vasodilatation. So let me tell you, hypotension with tachycardia, hypovolemic shock, hypotension and bradycardia, it is seen in neurogenic shock. Okay guys, next question. Instrument used for harvesting skin graft. Instrument used for harvesting skin graft. Easiest question. It is one of the frequently asked question. Lily, very good Lily. First time you are replying correctly, and first person to reply correctly, Pooja, Humvee's knife. So it's Humvee knife. Humvee knife, very good Lily. Humvee knife. Next, 20 gauge IV cannula. What's the color? 20. G20. Organized by BJP. BJP, what? Lotus. What is the color of lotus? Tell me, pink. So what? 20G, it's pink. It's pink. So 20G, it's pink. 18, it's green. So it's 20, it's pink. Next, what is the most commonly used Foley's catheter in males? In males, we use 16 French. In females, we use 14 French. Can you tell me the color? 16 French is used in males. What's the color, guys? In males, 16 French, tell me the color. Orange. Avinash, very good. It's orange. Orange. Everybody is asking the color nowadays. So what? Orange, right? And 14 French in females, what's the color? Green. Okay. So 16 French, what's the color? It's orange in males, and females 14 French, that's green. That's green. Clear, guys? So it was amazing session, and thank you for participating. There was very strong and active participation by all of you. I hope your preparation is going well. Keep doing hard work like this only. And these are the last 3-4 months which are very, very crucial. So keep working hard. All the best from the whole PrepLadder family. All the best, guys. All the best. Thank you very, very much. Thank you.